first thing that we're going to do is I just need to ask you some basic questions about yourself and your lifestyle, okay? Okay. So firstly, what is your full name? Okay. Gotcha. And your date of birth? Okay, perfect. And about how much sleep do you get at night? About how many hours? Okay. And tell me a little bit about your diet. Okay. Do you follow a specific dietary plan, or do you just kind of eat intuitively? Okay, perfect. And finally, do you have any specific concerns going into today? Any pain? Anything you want me to check out? Okay, alright. We'll just give you a general examination just to make sure that everything is healthy and happy. Okay, so I'm just going to put on my gloves now. Okay, and the other glove. Good. And I just have a little clip here I'm going to put on your finger that will test your blood oxygen level, okay? Okay, so just hold out your hand for me. focus on my finger, following it wherever it goes. Good. Are you having any double vision? Any problems with this? Okay, good. And as it goes out and in and back out. Okay, very good. We're going to check your peripheral vision next. So I just want you to look straight at my nose. I'm going to be bringing my fingers into your field of vision, and I just want you to say yes when you can see them, okay? Look straight at my nose. Good. 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 Very good. Now keep looking at my nose. I'm going to flash up some numbers on my hands in your peripheral vision, and I want you to tell me what number I hold up, okay? So looking at my nose still. Good. Very good. Perfect. Good. 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 Perfect. One more time. Okay, good. Next up, I'm going to have you close your eyes, and I'm going to move my pointer finger to different places in your peripheral vision. And when I tell you to open your eyes, I want you to look at my finger, focus in on it as fast as you can, okay? So just open your eyes and look at my finger. Good, that was a test run. Okay, so close your eyes. Open. Good. Close them again. 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 And open. Very good. And one more time. Close your eyes again. And open. Okay. Very good. Very good. For our final vision test today, I'm going to draw some numbers and letters on my hand, and I just want you to tell me what it is that I draw or write. Okay? Are you ready? Good. That was A. Good. B. Good. 8. Good. That was a 3. Z. Very good. Good. That was a 9. C. 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 Very good. What am I going to draw next? What am I going to draw next? Good. That was a 6. And one more. Good. That was a 1. Very good. Next, I'm going to check your nose, okay? So just getting my light here again. And I'm just going to hold up on your nose gently. Just put your head back a little bit for me. Okay. Just looking in your nostrils. I don't see any excessive drainage, any buildup, or ears and your hearing now. I'm first just going to palpate on either side. Any tenderness over here or over here. Okay, that's good. Taking my light again. I'm just going to look in your ear. And I do not see any excessive drainage or redness. I do not see any dryness either, which is good. Okay, and the other side, looking in your ear. Again, no drainage, redness, or swelling. And I do not see any dryness either. Okay, that is very good. Now we're going to test your hearing. So I just need you to tell me, can you hear this? Okay, can you hear this? Good. Now I want you to close your eyes and tell me which side you hear the sound on, okay? Are you ready? Good. Perfect. Good. Perfect. Good. And one more time. Okay, perfect. Now, keeping your eyes closed, I'm going to make a sound by your ears, a shushing sound, and I just want you to tell me when you can no longer hear the sound, okay? Good. And on the other side. Perfect. And keeping your eyes closed for one final test, I'm going to whisper a word or phrase into each of your ears, and I want you to repeat back to me what I say, okay? Ready? Buzzy Wuzzy was a bear. Perfect. And on the other side, Fuzzy Wuzzy had no hair. Okay, perfect. You can open your eyes again. So the next thing I'm going to do is just gently percuss on various parts of your body, and I'm going to be testing your reflexes here, as well as checking for any pain, tenderness, or tingling, which could indicate an issue with your nerves, okay? So first up, I'm just going to put my fingers on your chin, and I want you to just relax, okay? So let your jaw gently hang open and just relax, and I'm going to tap. Okay, good. Any problems with that? Alright, and I'm going to do this on your chest as well, just percussing. Any tenderness anywhere as I did that? Or tingling? Okay, and finally I just want you to lay out your arms flat for me so I can percuss. Okay, tell me if there's any pain. Any pain? Okay, that's good. And I'm going to gently tap right here on your wrist, just like that. And I want you to tell me if there's any tingling or shooting pain in your hand, okay? Are you ready? Any problems with that? Okay, good. problems there? Okay, and once again, tapping on your wrist to check for any shooting pain or tingling. Any problems there? Okay, that's good. Now, because we already have your arms in position, I just want you to stick them out to the sides, okay? And just close your eyes and keep them there. And I'm testing your balance here. Okay, very good. Good. You can open your eyes again. The final portion of our cranial nerve exam will be testing your facial movements, head movements, and sensation, okay? So the first thing I'm going to do is I'm going to gently hold your head, and I want you to try to turn your head to the right, okay? I'm going to fight you just a little bit. Okay. Now gently move your head towards the left. Okay, good. And holding it on the top and bottom here, can you just try to lift your head up? Okay. And bring your chin down to your chest. Look down. Okay, good. Now I'm just going to put my hand here on the side of your face, and I want you to turn into my hand. Okay, good. And on the other side, just turn into my hand. Okay, perfect. Now I'm going to have you do some basic facial movements. So first of all, if you can just squeeze your eyes really tight, and I'm going to try to open them. Just fight. Okay, good. Next, you can open your eyes. I'm going to hold them open, and I want you to try to close your eyes, okay? I'm just going to fight you. Okay, very good. Now, I'm going to put my hand on your cheek, and with your mouth closed, I just want you to push your tongue into my hand. Okay, good. And on the other side. Okay, perfect. Now, can you try to raise your eyebrows up? Good. And furrow your eyebrows. Good. Yes, you can just follow me whatever I'm doing. So give me a big smile and a frown. Good. And can you puff out your cheeks? Okay, good. You can stop. Can you suck in your cheeks and make a fishy face? Okay, good. And just doing some basic eye movements as well. So can you look up for me? Good. Look to the side. Okay. Look down. And to the other side. And can you roll your eyes? Good. Now, not everybody can do this, but can you flare your nostrils? Okay, perfect. Now, I'm just going to touch you on different parts of your face here, okay? So, can you feel that? Okay, good. Can you feel that? Does it feel the same on both sides? Okay. Can you feel that? Good. Can you feel that? And does it feel the same on both sides? Okay, good. And finally, can you feel that? And can you feel that? Okay. And does it feel the same on both sides there? reaction time. So what I want you to do is just hold up your finger, and when I say go, I want you to move your finger like this. Only when I say go. You ready? Hold it up. Go. Good. Go. Good. Go. Good. Go. Very good. Go. Perfect. Go. 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 Good. Go. Good. Go. Okay. And go. Very good. There seems to be no issues with your reaction time or anything else I've examined today. I noticed that you had some tenderness when I pressed on your sinuses. Have you also had a bit of a sore throat or anything like that? Okay, well, it seems like you may have a common cold, but other than that, no issues today that I've observed, okay? Do you have any questions for me or any concerns? Okay. Yes, my prescription would be lots of extra rest, hydration, and if things get really bad, then maybe some Dayquil or another medicine with acetaminophen. Okay, good. So, I recommend that you go home and get some rest now. Good, you've been a wonderful patient.